All right.
Hey everyone. Let's talk about, I love that song, Let's Talk About Sex. I wish we could somehow have that playing. You know that
Hi,
song?
I'm sorry, technical difficulties. Dr. Celia Egan. I'm the internal medicine side of the practice at True Women's Health. And I'm so excited to talk about sexual health and pleasure because it's something that we don't talk about as much.
Can you hear me okay? No?
Nope, no sound. So I'm going to roll
Okay.
off. I'll be right back. Take it away.
All right. Can you hear me? I guess it's just me right now, and we'll get Dr. Egan back in here. Tonight, we're here to talk about sexual pleasure. And often in midlife, many women come in talking about the fact that their desire is lower. And so I'm excited to be here tonight. And I know Dr. Egan will be back here in a minute, but I'm excited to talk about this from a standpoint of wanting to help women not have to suffer. And that original picture that popped up to talk about tonight's event, you see a man and a woman dancing. What's really fun is one of the most common hits we're getting on the website right now is men wanting to know how to talk about sex, how to talk about menopause with women, the women in their lives, without getting in trouble or having some language to talk about it. So we certainly invite all questions. Please put your questions in the chat. Some people get a little shy. They don't want people to know they're in here talking about sex, but we hope we make this a very conversational event. Celia, can
Yeah,
you hear me?
secret, I can, thank you. But secret, everyone, most people have sex, so it's okay.
It's okay. Exactly. Exactly. And it's just so important to talk about it. This morning I was on Fox 17 talking about sexual assault, which of course safety is the number one thing. And we'll talk about that more tonight. But then it's talking about all the aspects of sexual health. And Celia, don't you think a big part of this is that people don't have language to talk about sexual health?
You know, patients don't have language, doctors don't have language. Both of us together, I mean, not at Truman's Health, but other doctors' offices, we're fumbling through. The patients feel awkward, the doctors feel awkward. And then what ends up happening is questions don't get answered and people leave confused, frustrated, and they're sort of doing the same thing again and again.
Exactly. I mean, truly 15 years ago, if someone had said, hey, I don't want to have sex. I really love my partner, but I just don't. I don't care if I ever have sex again. I would have no idea what to say, right? I might be like, I might be able to kind of skirt around the issue, but I just didn't know. And so all this training has been so helpful. So I love that you and I are comfortable talking about this. I think it helps to have solutions, right?
It totally does. And I think it also helps to have even a pathway, just like everything else in medicine, right? If someone comes in and they're saying, I have a cough, I have in my mind a pathway of how I need to pull in different tools to find them an answer and find a treatment plan. And, with the tools that we use at True Women's Health, like the sex deck, which I know we're going to go over, it's starting to create that pathway that doctors and patients can use to sort of understand and rule things in and rule things out and different directions to go to get to a treatment plan.
Yeah, and one of my biggest challenges was just that. Like I would go to ISHWISH, the International Society for the Study of Women's Sexual Health. We go to the menopause conference, we're reading, we're listening to lectures. But like I think, how am I going to remember all this? And people have so many, like sexual health is such this nebulous, cloudy sort of thing. Like, how do we start to parse out what it is, right? Like, what is it that is the issue? Is it their upbringing? Is it, what is it? So, my goal tonight is that people have some more language and they have some more ways to think about it. And we can sort of get rid of the shame, right? Like we can shine some light on this topic that people aren't feeling alone. They aren't feeling ashamed. We know that 80% of women have and people have issues with sexual health over the course of their lifetime, but only 20% will ever bring it up with their provider. And docs, we know it's an issue, but only 20% of docs will ever talk about it.
Yeah, and I think hopefully more practices like ours will pop up so that more women across the world can have better, providers that are willing to listen. And I think as we get more of our tools out there, I think that will be more likely to be the case.
Yeah. And I love you reposted this the other day on Instagram, and I like cheered. You said amen, I think. It was a doc on social media who said, "Why are so many doctors now on social media?" And it's because so many influencers are trying to act like doctors, right? And so, but part of it is that there has been a lack of talking about it. Us in traditional medicine, we dropped the ball because, again, we didn't know how to talk about it. And so all these remedies have gotten out there that maybe aren't safe, aren't healthy. And so now that we're finally catching up, us in traditional medicine, to influencers, to people's concerns, now we got to get out there and talk about it and be able to offer these tools.
Yeah, I mean, love it or hate it, places like social media are places where women go when they're tired, when they're curious, when they're upset, when they want to find an answer. And agree or disagree with that being a pathway, it's the truth of how things are. And, something that I know you and I hold very dearly is that when we're in visits every day, it's not just that we're there to serve the patient. We are, but we're also learning, and we're also, learning different things about different treatment models, things that work, things that don't. And so we feel like when you and I go on social media and Instagram, we feel like we have to be there to be able to provide that guidance and that knowledge, not just the knowledge like you read a book, but it's the knowledge of being in the trenches every day with these women and working through some of these issues.
100%. And I think our approach too is a little different than maybe some on social media. I think it's really important that the people that are out there a lot, Kelly Casperson and Rachel Rubin, like their approaches are, different than ours. There's a little bit more, how would you say it? There's
I think
more
there's a lot of
anger.
certainty. I think there's a lot of certainty
Yeah.
around things, and maybe a bit of the shock and awe of the lack of what's available, right?
Right.
I think we keep trying to create a space where it's, creating curiosity and comfort around topics, a little bit
Yeah.
different of a tone. Yeah.
Yeah, and I think all tones are good because again, it gets it out
Mhm.
there. But then,
Yeah.
what we do, especially with patients, is like I'd like to create this. It's a sacred space. Like people are talking about their most personal things, and this morning talking about sexual assault on Fox 17. Again, safety is number one. And I talked about Jane, who came to us and talking about her concern. She just thought it was perimenopause. Like, I'm tired, I'm not sleeping well, my partner and I were busy, we're not getting along. But as I went through the sex deck, the card that came up for her where she got kind of quiet was history of sexual abuse. Sorry about my dog. And that was the card that came up for her. And so we were able to then slowly over time tease out that was maybe the issue. And over time she was able to feel much more comfortable. Anyways, we're getting off topic a bit, but it's there's so much to talk about. So Celia, what got you interested more in sexual health? I would guess it's the interest in taking care of the whole woman and knowing how everything affects
Yeah,
everything.
I of course I think that's always number one. And number two, I do think that it felt great to have language around something that did feel previously uncomfortable. I mean, I'm like a Catholic schoolgirl, so that world felt uncomfortable, and then gaining language, gaining comfort in a space where no one is always a great place to be able to provide gifts for women. But I think lastly, something that's not thought about as much is this overlap between your total body's health and sexual health.
Mm-hmm.
And sexual health is almost like this little window into your rest of your even metabolic health, your blood sugars, your mood. And it can be so interesting to say, wait a minute, like these things are happening in my sexual health world. Maybe I should look deeper into some of my other medical problems to see if there's something else that needs to come up. So, I mean, we've talked a lot about this in some other previous Facebook Lives, but that
Sure.
role of vascular disease and how, the blood flow goes to those important sexual organs like your clitoris, and how changes of, vascular flow and nerve damage from high sugars can then change the way your clitoris responds, and that changes your whole sexual health. That's an amazing picture or window, like I said, into your overall health. I think for men, definitely we see, vascular disease being kind of the root of sometimes erectile dysfunction. And we kind of have to tackle and battle sort of the metabolic piece there to improve inflammation, male hormones that fall as men struggle with obesity. So again, it's just this beautiful window into a lot of other things.
And I think too, as we then look at, let's say, solutions for metabolic health, as metabolic health improves, sexual function improves. And so sometimes it might not be, I want to go for a walk, I have poor energy, but boy, if
Mhm.
maybe it will help my sexual health, then I'm going to go for that walk. So it just really, or I'm going to cut out sugar, or I'm going to be motivated to take a statin.
Yeah. Well, I'll tell you, so much in the weight loss world, I hear when a woman comes in and she's like, I know I need to make better food choices, right? You don't need to harp on me about not eating donuts. I get it. But I struggle because maybe my partner doesn't, right? And maybe my partner is ordering takeout, or maybe my partner is pulling the pretzels out at 9 p.m. as we're watching TV. And it can be a great, like, hey, we want a better sex life together. Maybe together we can start making some of these changes that will, ultimately lead to the goal, maybe is having a better sex life, but it's going to make them both healthier either way.
Right. So it's so fun. Like while you talk, I just think of all the different sex debt cards that apply, right? We know that women who exercise and men, women who exercise, they have better sex. They're able to feel more fit, better self-image. Women who do yoga have better orgasm. So in that, maybe let's start to get to some language. I love first talking about, what is libido or what is desire? And we talk about there's spontaneous libido where you just think about sex.
Hmm.
And then there's responsive libido where you respond to a cue. So let's say you respond to a cue of your partner saying, hey, or it's Friday night, or a certain song comes on, or it's Sunday morning and the kids are still sleeping, right? So it's like, what is that cue? And we find over time, some women, for example, never have spontaneous libido. We think
Hmm.
about the chastity culture.
That gets buried down deep, like and never told to come up, which
Yep.
isn't necessarily the right thing, but that
Right.
happens to women sometimes. It
Yeah.
becomes it gets associated with that negative, like if you have a sexual thought, therefore it's bad, and gets that negative
Yeah.
association.
Remember, I had a patient who said, for years I was told, don't have sex, don't think about sex. It's bad, it's bad, it's bad. And then I get married and it's supposed to be instantly good. And
Well,
it's
it's
supposed
like
to have,
sex kitten that came out of nowhere.
yeah, this
Yeah.
amazing. And then I had sex and it hurt. And I was like, really? Like I put this off? Like, guess I wasn't missing a whole lot, which is then
Yeah.
really sad, right? So, so important. And, where that responsive desire is maybe you've had really good sex in the past, you had good desire, but now there's a reason. We have this new option here on our StreamYard, on our platform. Thank you, Missy, for coming up with this. So we want to know how this works on your end. So this quiz, you guys can
Yeah,
probably
we
read it.
we love having patient feedback and interaction, and really figuring out what's driving your thoughts as you're sort of here listening to us chat. So one option, obviously everyone can bring typing questions and comments, but we think it's kind of fun to do a quiz, or it's a poll. And forgive me, my phone, it's very small, so I actually can't read it too well as I age
Want me
here.
to read it?
And so it's really exciting to see everyone's thoughts and feelings about it. So is it that they have to push, like as they're kind of listening to us um on their screen, I'm assuming, push a button?
Yeah, or I wonder if type it in. Have you ever asked your doctor about libido, orgasm, or desire? Type 1, 2, or 3 in the chat. Question
I
number
see.
1, no, I've never brought it up. 2, yes, and I got help. 3, yes, but I was dismissed.
Mhm. So we love to
And
hear
yeah,
feedback. The dismiss one is hard to because to have to be dismissed by a doctor. I mean, you never want to hear that. That's terrible.
I know. And then the problem is you might never bring it up again because you feel like,
100%.
well, yeah,
Yeah.
right. Like I shouldn't have brought that up, or everyone has good sex but me.
Mm-hmm. Mm-hmm.
So definitely an issue. Um, when we talk about treatments for libido, if we, oh, wow, look at that. Okay, we see this. And I bet, Missy, can you see on the back end how many people are answering this?
Oh, fun.
Okay, cool.
Yeah.
Thank you, guys. This is
Yeah.
awesome.
Super fun. Yeah, super fun. So The treatments for libido.
So treatments for libido, and as we get to the sex deck, and again, we want to be able to respond to your questions, of course. So please, whatever you have. But when none of the cards apply, like as we go through the sex deck, we think about all the different reasons for low desire. When none of these cards apply, and or you're making progress on these cards, but still you're not feeling that spontaneous libido, or you're not able to respond to a cue, there's a condition called hypoactive sexual desire disorder. It's in the DSM-5. It actually is a real psychological diagnosis. And how we think about it is that the switch in the brain is just turned off. I mean, there's a sexual desire center, and there's accelerators, there's brakes to this. And so maybe that switch just got turned off. I remember telling a patient about that, and she just broke out into tears. She's like, "You mean I'm not broken?" And so the treatments for this, there's now 2 FDA approved treatments. One is Addyi, and it's a daily use medication that's a serotonin modulator. The story is really interesting. There's now actually a movie out about it, because the inventor, Cindy, talks about this in the movie. But the story is that this medication was being used to study for depression or anxiety. It's a distant cousin of Lexapro or Prozac. And it didn't help with depression, but women taking it were horny. And we know that by 3 months, 2/3 of women who take this medication actually have improved desire, and often then increased arousal desire. So that's Addyi. And so that's a medication Dr. Egan and I are both very comfortable prescribing. Everyone at our office is, and it can be very effective. Do you want to talk about Vyleesi, Celia?
Oh boy, you gave me the good one.
Yeah.
So Vyleesi is been dubbed in our office the horny shot. It is a kind of as needed, shot that you would take when you are ready for a huge boost in libido. We find that it can be very effective, almost too effective, right? In a sense that we've had women come back in and be like, I don't have time to have all the sex all the time. Why don't you warn me about that? And so what you do is just like, some of our weight loss drugs that we take and some of the other drugs that are available for migraines, it's a subcutaneous shot. So you kind of pinch an inch and you would poke it in there with an auto injector. It lasts anywhere from, we say 24 to 48 hours, maybe a little bit longer for some.
Well, common 12, but yeah,
Okay.
like sometimes it's even longer. And so it's like you give yourself the shot, maybe have dinner, and then a half an hour later. But
Okay.
the common problem can be nausea. So researchers thought women aren't going to want to give themselves a shot. I think now we're all kind of used to that, so no big deal. But then, women aren't going to want to do it because of the nausea. And actually, we will prescribe it with Zofran, which can help treat the nausea without other side effects. And usually after the first or second shot, the nausea gets better. The only contraindication for Vyleesi is uncontrolled hypertension. And so we just have to make sure your blood pressure is under control. And Kathy Lewis, good question. There's no age limit for these 2 drugs. The cool thing about Addyi is the FDA makes us, drug companies choose, is this drug going to be indicated for pre or post menopause? And Addyi was approved for post-menopause. They thought it would be, pre-menopause. They thought the market would be bigger. The FDA just allowed it to be approved for women also post-menopause. So insurance will pay for it if you're pre or post-menopause. Vyleesi can be used pre or post. It's only FDA approved for pre, and but you can pay cash. It's reasonably priced for post-menopause. So again, it's just, there's no age limit. It's just understanding when insurance will pay for it.
Yeah, I think I've had such different feedback about both, right? I have some women that maybe the thought of having all that pressure for a one-time event feels like too much, right? If they're kind of have no desire and that hasn't been, sex has not been something, intercourse has not been something that's been ongoing. The thought of like all of a sudden having this weekend or a night full of sex feels like a lot, and they choose Addyi. And then I've had people that are like, bring it, right? Like I'm ready for that next step. Like, let's see how this goes. And so
Yeah.
I think it's a great conversation to have, and it feels great that we have both choices.
100%. And I think too, I've seen women who take the Vyleesi which really can help with that spontaneous desire. I joke that you're going to be chasing your partner around. And or, it also helps with arousal, with orgasm. And so a lot of times if you use the medication once or twice, it's almost reminding your system, oh, I really like this. Oh, this can feel safe. This can feel right.
100%. So I always talk about, you look at these, professional athletes, right? And they do they do these motions and this practice and, those, I don't know how many people watch,
Body memory.
professional football,
Yeah.
right? But those quarterbacks do those movements again and again. And why are they doing that? They're doing that because they want that nerve, muscle, brain connection that becomes just slightly flawless. And you can do that for anything. And so just getting this started of getting these nerves fired back up, getting your pelvic floor muscles just back in line and used to what it feels like to be in those positions, like can really be helpful. And, I think the kind of you use it, you lose it, you don't use it, you lose it kind of, right? I think the opposite is true. The more you kind of get started, then the more ready those muscles and those nerves are to fire and be available.
Exactly. And then it can take the fear away again and just start to create that connection. Sometimes, again, that fear, that performance fear really can keep people from wanting to be intimate because what if I don't have an orgasm? Sometimes men really shy away from sex because obviously their ability to have an erection is fairly obvious, not so obvious for us girls, right? But a lot of times they won't even want to go there because what if I can't have an erection? Or last time I had an erection, but it didn't stay hard that long. So I don't even want to do that because I'm going to feel inadequate. I'm going to feel less like a man. I'm going to feel old, or all the things that go along with that. So sometimes just having sex and taking performance off the table. I want to remember, what is sex? It's intimacy and it's pleasure. It doesn't have to be like this mutual orgasm that's amazing like it maybe was when you were 20. And it's like, just it's sex, it's pleasure and intimacy. And how can we sort of get back to that? One of the other treatments that's not so much medication, it's called sensate focus. And sensate focus can be a guided treatment with a sex therapist. And it's like one person touching the other and no response, is the one person can't respond back, but then there's touching. And so it's like slow reintroduction to just being comfortable touching each other and being touched.
I think one of the things that we've talked about before, which I love because I think it's just so important to say again and again, is about that word that you use, connection, and how men experience connection differently. I don't know if you want to kind of review what we've talked about because I think it's just so important.
Well, just in terms of, do you mean like
So
connection?
women don't want to be intimate unless they feel connected,
Yeah.
and men use intimacy for connection.
Feel connected.
So yes, and I remember when I used to take care of men, although I still take care of a few, we would be like, hey, how's your sex life? And the word that they would use again and again to talk about why they were frustrated with lack of sex for a variety of different reasons was connection. They were like,
It
I want to
wasn't
be
to have the
connected to my
orgasm,
wife. Yeah.
right?
It was
I mean,
not orgasm. It wasn't to get off. It was, they're like, I don't feel connected anymore to my wife.
yeah.
Right. And I think that even just the beginning of introducing these different, touching or even just intimacy without necessarily intercourse is just tipping the scale to a woman feels connected, right? Because it's touching and it's feeling good. A man starts to feel connected, and then you're both headed in that right direction, or any other sort of partner source, you're headed in that right direction.
Right. Speaking of partner source, I was just, last summer I filmed a documentary on menopause in Costa Rica, and one of the couples there as patients were a gay couple. It was so fun talking to them, and they were there because the older of the couple was not wanting to be as sexually active, and the younger was like, what's going on? Is this menopause? And she was like, it's fatigue. And again, it's they just started to feel disconnected and talked about that a lot. So to your point, it's, whoever your partner is, it's talking about, why do you want sex? What's important about sex? I had one patient who's like, my husband is just, he doesn't understand that I'm tired and I'm so busy. And I said, well, did you ever say, hey, if you just empty the dishwasher, I'll be more available? And she said, now I wish I hadn't done that, because he empties the dishwasher and stands there and looks at me like,
The kitchen is spotless.
that's exactly, like, what else can I do?
Yeah.
It makes me really sad when I see or hear about couples drifting. And I'll say, do you not even want to hold his hand, because then you're afraid that's his signal to say, oh, cool, we get to have sex tonight. And she's like, exactly. Then I don't even want to hold his hand. And so then there becomes this like disconnect. And so it's like, how can we use some language to say, hey, tonight I just need a hug. Like, tonight I don't want to have sex. I just want to be close to you. And then over time, we start to have more of that conversation.
I think one of the phenomenons that, we sometimes see with the younger moms. So, after a woman has a baby, sometimes obviously her libido goes down. She's tired. And even, please correct me if I'm wrong, but even breastfeeding, right, changes some of the
Lowers your
hormones that lead to,
estrogen. Yep.
And I think as, young moms are there, like they almost just get like overly touched, like little kids and toddlers and babies. And like sometimes like young moms are just like, I just like don't want to be touched at all. Right. Like just not another person cannot touch me or need me. Right. And it can be helpful again to have some language around how can I say that and be in a place where maybe my partner can just do the next steps. Maybe you need to take a bath first. Maybe you need some personal time before you're ready to be like touched again, but in a different way.
Right. Because often the response of the partner is, oh my God, I come last. Like, you've got the
100%.
kids and you're making dinner and you're doing all the things, and like, hello, like, do you not even care about me anymore? And so then it just becomes this divide. I think what you're talking about too, with like breastfeeding with low estrogen, a lot of times women have so much, just like in menopause, have so much pain with penetration, because with low estrogen, the vagina gets really dry. So for you breastfeeding moms out there, vaginal estrogen is very safe while breastfeeding, and it can really help restore and even reduce bladder infections and all the things. But it's really important to know that pain can be a big damper, of course, on sexual desire. Why would you want to do something that hurts?
Yeah. Well, I guess that leads us into our sex deck. How should we get started of reviewing some of these topics?
Well, I wonder if we want to talk about vaginal health or pain. I've got the list up over on my
I think that's great.
Here. When I think about pain, and when a woman comes in and says, I have pain with sex, I get out, you and I both love to draw, and I'll draw, it's three things. It's either the skin on the outside, it's the skin on the inside, or it's the pelvic floor muscles. And so I think maybe getting to the physical cards. So you guys, the sex deck, I invented it because I would go to these lectures and I would think, how am I going to remember all this stuff? And how am I going to communicate it in a visit with a patient? How is she going to take it home and then think about it for herself? And then if she wants to share it with her partner or they use it together, like, how are they going to remember all this stuff? And so I thought first about a puzzle. Actually, Lynn's idea was the cards. Like, how can we think about the cards? So these are the 27 reasons for low desire, divided into physical causes, into interpersonal causes, like he's not trimming his nose hairs, right? And or psychological, like job stress. So do we want to go to the pain card?
Yeah, let's go to the painful card. Painful sex card.
Where's that one? Okay. Here's this one. And you can buy your own copy of the sex deck. It's on the website. Sorry, it's a little expensive, but the paper is good quality. So I think they're $9.95 or something
very
like that.
nice quality.
Yes. But
so the causes of painful sex, and maybe you can help us divide up these ones into what you were talking about. Pelvic muscle spasm, so your pelvic floor, dryness from low estrogen, lichen sclerosis, endometriosis or fibroids, pelvic radiation, or prior pain. So
when we think about like conditions on the outside, so especially women, you think about the vaginas like this. Here's 6 o'clock. Here's where you pee up here. Clitoris is up here. So this is like the opening. You know, a lot of women will have pain in this area, especially, for example, if they have low estrogen. They're on the birth control pill. They are in menopause with low estrogen, or let's say breastfeeding. And then the tissues out here are where women will get lichen sclerosis. And it's essentially a condition like eczema on the outside, where the skin gets really thin and sticky, and it can stick together. And then the skin will stick and then it tears. And so it can feel like knife blades or cutting, like, oh my God, right? Like, how could you have sex if this area is painful and tearing? So it's on then physical exam, we can see this. And then of course we could offer treatment options if that's the issue. So those are conditions from the
Things on
outside.
the outside. Conditions on the inside, I'm assuming endometriosis and fibroids.
Yep. And so, the number one again is low estrogen. Like that skin in the
Mhm.
vagina is so responsive to estrogen. It makes a really helpful mucus layer, snot layer, slippery layer on the vaginal skin. And those cells are able to then produce a response to like sexual arousal. I think about a healthy vagina with estrogen, it's like a brand new plush carpet. And without estrogen, it's like threadbare carpet on the plywood. And so we want that layer thick and vascular and able to respond. And, the other thing is, yes, if there's endometriosis just on the other side of that vaginal skin, it makes that vaginal skin tight. Endometriosis is like rubber cement, and it's just tight and it pulls and it's stuck. And so, again, it obviously doesn't sound very appealing.
Yeah, I wouldn't be surprised. I have no data to say what I'm going to support what I'm saying next, but I wouldn't be surprised over time if we learn that the vaginal microbiome is also involved with
Huge.
it shifting and changing as our estrogen levels in our vagina change, and how important it is, to keep that vaginal microbiome like
Yeah.
healthy and robust.
Well, and what estrogen does is it supports the lactobacilli. Lactobacilli make hydrogen peroxide and lactic acid. And it's so important that the vaginal pH is 4. And that is often coming from these lactobacilli. When we get too many E. coli or anaerobes or all the ones that cause maybe bacterial vaginosis, it throws that biome off and creates inflammation, to your point. So it's all about keeping that biome and so healthy.
So I'm going to ask a question that I know the answer to, but just because I know I hear it a lot. Like, what's then the role of douching? Like,
Sure.
what's the deal with that?
So with douching back in the day, as you know, women douched all the time. Our grandmothers, like every time they had
Which
sex, they
is basically
would
like throwing water or soap or something up into your vaginal canal to like rinse it out.
yeah, and usually
Yeah.
even like the vinegar douche, right? Like because again, it's that odor. Back then, there wasn't the treatment for bacterial vaginosis, and so with antibiotic ointment or cream, and so the douche like took away that odor. There was deodorant douches, and so there was so much douching that they rinsed out the good bacteria, and the good guys can come back, even though you might have rinsed out the bad guys for a hot second. So now we know that douching can be okay, especially if it's done, let's say, after a bout of bacterial vaginosis or a bad yeast infection, but just maybe once a quarter, just to rinse out, start fresh, drop the pH. But then there's also a product like Good Clean Love that we sell at the office or Myers or online. It's the vaginal moisturizer. A moisturizer is what you can use twice a week, where a lubrication is what you use at the time. And Good Clean Love offers both products. Thanks, Missy. Or Sam. And they lower the pH of the vagina. And it's an aloe vera, all natural gel. This was invented by a woman whose husband was a physician, funny enough, and didn't have answers. So she's like, I'm going to figure this out. So she created this product. We've met her and she's lovely and we thank her. So these products are really helpful to rebalance the vaginal environment.
Thank you for that clarification. I think we hear it a lot, and especially as women struggle with different vaginal infections, I think it's just good to clarify exactly what your thoughts were on douching, because I know it can lead to, again, more issues with pain and with intercourse.
You bring up the pain of the muscles. I remember I had a patient who did the acrobatics, with up in the ribbons, where you put your legs in the ribbons and you twirl around. It's so amazing. But to do that, she had to hold, of course, her pelvic floor so tight to balance in the ribbons that her pelvic floor was so tight, she came in because they couldn't even have sex. Like there was no room. It hurts so bad. She's like, it feels like there's a knife. It's sharp. Like there has to be something in there that's cutting me. And actually what was happening is that as there was attempted insertion at penetration, like the skin just was pushing against muscles that were so tight that it
Hmm.
felt like tearing pain. And, turns out she had such a tight pelvic floor that she couldn't even have a bowel movement because the BM couldn't make it down through the pelvic floor. She had issues where she couldn't empty her bladder. And with pelvic floor physical therapy, Valium in the vagina to help those muscles relax,
Yeah.
over time she was able. And people who do a lot of Pilates, or we have patients who are professional runners or athletes or
I'm
very,
going to be honest. I think there could be a variety of different scenarios, not just heavy exercisers that struggle with pelvic floor
right.
tightness.
Exactly.
Yeah.
Multiple surgeries. We've definitely seen that. People who have had endometriosis surgery and still
Hmm.
there's internal scarring. Or you sit at a desk all day, you drive an hour each way to work, and as you sit, your hips rotate in, your pelvic
Hmm.
floor shortens, and it just becomes so foreshortened. Bladder urgency is often the first symptom because the bladder doesn't have room to open because the muscles are so tight.
Hmm. Yeah. I continue to be impressed by the importance of the pelvic floor of everything. And I think, between sexual health, GI tract health, I mean, those muscles and the coordination of all those muscles together are just so important.
I know.
And boy, it'd be really hard pressed to find me someone who I wouldn't write a referral to pelvic floor therapy for,
I
right? I
know.
feel like we love using many different pelvic floor therapists in our area to find the right fit for the right person who needs help. But I would have a very low threshold if I were a woman to seek one out, just to even 1 or 2 sessions to learn about where their pelvic floor is at. Maybe there's something they can do just to feel a little bit better in some way.
Yeah.
But yeah, please lean
And
into that
even
resource.
Yeah, and even like a woman with hip pain or back pain,
Absolutely.
doing an exam, it's like we can just feel those muscles, which ones are tight. And other solutions for those are like, for example, at the office we sell Millie, or you can get her online. It's a vaginal dilator that goes into like the lower third, lower half of the vagina, and it really can help, especially like with someone who's had pelvic radiation for uterine cancer or for anal cancer. We have several patients who have had anal cancer, pelvic radiation, and everything is so tight. And that's where it comes into play that we've got to get those muscles to be stretched out again. And then the pelvic wands help those muscles that are way up high. The
Mhm.
obturator, the piriformis, gets way up high and helps with not only hip pain, but also sexual health pain. Sorry, we could talk about that forever. That's the
That's okay. No, I
gynecologist
think it's
coming
just a
out.
good reminder of how having a conversation about this is so important. And there's so many different tools to sort of get after what your issue is in terms of what's limiting you from having intercourse or having a better experience.
Yeah. Do we want to move from this one maybe into vaginal dryness? We
Sure.
have on the list, and so one of the topics that often comes up in perimenopause, menopause is this vaginal dryness. I mean, you can have vaginal dryness just because it hurt the last 5 times, and your lady town, your
Not
vagina is
excited.
like, she's like, you want to do this? No, we're not doing
Yeah.
this. She's
No,
way
thanks.
smarter than
Yeah.
you are. So she
Yep.
just dries up.
Yep.
But we talk about genital urinary syndrome of menopause. And this is where we talk about treatments such as vaginal estrogen, vaginal DHEA, which is FDA approved under the name Intrarosa. It's a daily use suppository. Vaginal estrogen. The cool thing is for women who have had, let's say, breast cancer that's estrogen receptor positive, it really can be safe to take vaginal estrogen because it doesn't go in your blood. DHEA is non estrogen, it's pro hormone, does not go in your blood, and it can be placed in the vagina and make the vagina feel normal, right? Like we shouldn't have everything taken away because of treatment for breast cancer.
Yeah, again, I think it's just so amazing that there's some other options that are available. I think if you've not struggled with menopause or some, on some of these other medications that we know cause these issues, that maybe just taking some time and reflecting of what you can do to, again, feel a little bit more aroused before you're going to be intimate or have intercourse, and taking a little bit longer time to sort of get there, to get that reactionary libido going, right? Just not 2 minutes and jumping right into that because you just may not be ready. That's okay.
And I love how you bring that up. Like so many women say, I have vaginal dryness, but my everything is good. It's well estrogenized. And it's to remind women that guys often can respond very quickly. Let's say They're like, really? We can? And 30 seconds later, right? They're ready to go. But women, even on a good day, it's 30 minutes. So if having sex is like the last thing on your mind and your partner's like, hey, you're like, all right, it's been a bit. Okay. Why not? And but again, 2 minutes later, it's not going to work, right? So it's really important to take a minute. I'll ask patients, "You have a vibrator, right?" And they'll be like, "Well, yeah. Have you considered using it even together?" And many
Mhm.
women will say, "I'm afraid to use it with my partner because I don't want him or her to feel like they're letting me down or they're not good enough or they don't know what they're doing." But I would say, partners have been surveyed and they actually say, no, that's really hot, actually. Like, I think that's really cool. I just wish they would do it with me because it's very intimate to see them excited and aroused.
Mhm.
So often, if you're able to pull out that vibrator or sex toy, whatever you want to call it, we sell them at the office. So if you don't want to go shopping on the internet or get things delivered or go to one of the stores, we have them right in the office. You can see them and touch them and see what they look like. They're not so scary. And to be able to have an orgasm beforehand, or at least kind of get the system going, that can really make a difference.
Yeah. And I think even using the sex deck can be a great way if you feel like you're unsure of how your partner will respond to using pulling in some of these tools. You can even just be like, oh, weird. Ugh, vaginal dryness. What it says here that I really should, right? And that it's a great way to be like, I didn't say it, Dr. Bitner said it, right? And I think that is just a great way to sort of pull some of this stuff in. So use these as tools that have to break down the barriers of a conversation and make it not your problem or my problem. It's here, right? That and the
Right.
tools are available that we can, because we all want the same thing, to be connected.
Be connected. And
Yeah.
what's fun is all of these cards apply to men, XY, except low estrogen, of course. High
Although I
estrogen
have a
and
urologist that says that that's true, but I know that the data doesn't support that. But yeah.
okay, cool. But really, these cards apply, and women who have taken them home, they said it so helped break the ice because speaking of a male partner, like, oh my God, he was so happy that I even brought it up at the office. He was
Hmm.
so happy that I cared enough to bring it up at the office and that we have a way now to talk about it. And it's not
Hmm.
your problem or my problem. It's a thing. It's real. It's not anyone's fault.
Yeah, absolutely. Okay. I think we
Which
talked a lot about physical topics. Maybe we can move on to some of your other favorite topics, maybe the interpersonal ones. We're kind of
thanks.
touching on that a little bit.
I was just thinking, I made a joke earlier about nose hairs, but is there mutual attraction and lust? And, for women, I think women are so hard on themselves. I think how you talk, Celia, about body image is so valuable. And I'd love you to talk about that. But also, it's like, it's a way for us to bring it up without, we might not want to say to our partner, boy, like, let's go work out together because you've gained weight. And like, how do you say that, right? Like, just as men don't want to talk about it, like, could you trim your nose hairs? Could you, like, do you care about your physical appearance? And as we
Yeah.
both, like, how do you think about that?
Yeah. I mean, I think that sometimes it can be about bringing up ways, you could say, I feel subconscious that, you know, whatever, that there's X, Y, and Z. And maybe you'll learn that that's not something that's really on the table, or maybe that's something that they love about you. Right. Because I think the messaging that we get from the media, and I know this is really tied into the weight world, is this like specific image of a woman, and that obviously changes over time. Data has shown, right, like over the decades, the what that woman is supposed to look like and the physical attributes, changes. So we can't even pin a tail on it, but your partner may want something completely different, and that may be you. I'm sure that is you, right? And so
Right.
having that conversation can be really helpful. I love the idea of even making things like naughty and forbidden. Sometimes that can be really helpful, right? Kind of pulling sex off the table for a week and kind of taunting in front of your partner can be really fun to be like, nope, this isn't, it's off the table. We're not going to talk about it, right? And kind of creating some of that drama, then that sexual tension that comes like when you're younger can be super fun. Um, when, some of the other hormones aren't there to be as supportive for that reactive libido.
Right. I love how you talk about that. But also, too, like women will say, well, like I feel self-conscious about my weight. I don't like how I've gained this weight. And, or my body isn't the same tone or strength, or you can't see my muscles as well. And I'll say, but have you asked your partner? And they'll be like, yeah, he says he doesn't care. I'm like, first of all, to stereotype here, guys generally tell you how it is, right? If they don't care, if they say they don't care, they don't care. But really, studies that show, and I think we know common sense, men will often say, I care about her smell. I care about her touch. I care about her skin. I don't care that she has extra weight around the middle. I don't care. I just want that physical connection. I remember I had one patient who said, I do okay until he touches my belly. And it reminds me that I'm uncomfortable. I said, did you ever say to him, please just don't touch my belly? And she's like, no. So she went home and said, could you just please not touch my belly? You can touch it anywhere else, just not that. And he's like, that's all I have to do is not touch your belly. Sure.
The dishes and not touching, sign me up, right?
No problem.
That's it.
I'll do that. Or even on a little more serious note, a patient with bilateral mastectomy after breast cancer, and her pain was gone, her vaginal health was restored, but she's like, I feel so uncomfortable because he touched my breasts. They're numb. I can't feel them. It reminds me that I feel less sexual and I don't have stimulation that way. I said, how about, could you say, I'm going to wear lingerie. I'm going to stay covered up. You can still look at the shape, like all the things that he said he really liked. But he said, I'm okay not touching your breasts. If that turns you off, of course I don't need to. And then they were able to pursue and get more comfortable again, just being pretty common sense about it, just saying the words, it's okay.
Yeah. I think, a lot of these sort of stem off of each other, like poor communication, lack of respect, lack of trust, right? A lot of those things are all kind of in the same thread of like learning to have these kind of more intimate conversations. And again, the sex ed can be a great way to just sort of even introduce the topic.
Yeah. I had a patient who said, I said, she said, I have low desire. And I'm like, well, do you like your partner? And she's like, well, not really. Like, we're not getting along. I don't really like him. I'm like, why would you want to get naked? Back to safety. Why would you want to get naked with someone you don't even like? Like, let's kind of reel this back. But even recently, a patient, I said, is your partner available? And she's like, well, yeah, he comes home every night. I'm like, but is he mentally available? She's like, no.
Like, turn the phones off, right? Like,
turn the phones off. But it was work, and he was worried, and he had issues with, his work partner, and like he was mentally just not present.
Yeah. And I think that the more, I think I deal with this a lot with parenting, right? Of being present for my kids and parenting, but the same is true for couples. Like, you can't just put your kids to bed and then you're both like on your phones, kind of zoned out in your own world. Like, take some time to be like, after 6 p.m. the phones stay in the entryway, right? And we're gonna connect together and connect as partners. So don't be afraid to ask for some of those things, because they're gonna lead to down the line more the good stuff.
Yeah. Speaking of good stuff, we get a lot of questions about orgasm. And so this is a common question. Again, people have a hard time talking about it. The first thing that is obvious for us first as physicians is about vascular health, like you were talking about. The clitoris, it's really important that she get blood flow. And as the blood flow comes in, just like in a penis.
Do you mind if asking, can you just even describe medically what an orgasm is?
So, like there's so many different ways to talk about it, right? Back in the Masters and Johnson, it's like increased blood flow and it's release of local stimulation chemicals that then make it up to the brain. People talk about orgasm, that there's that obvious clitoral orgasm, which is a much more centrally, it's located, more in the clitoris, but again, signals to the brain and that feeling of sudden pleasure, with a restoration and feeling cozy and all the things. There's also that internal orgasm. And we've got to get the t-shirts made, Celia. Like, are you in the lucky 30? Only 30% of women will have an orgasm with penetration. So often I'll ask patients, like, are you in the lucky 30? And they're like, well, what's that?
Yeah.
So that internal orgasm is much more associated with feeling safe, feeling vulnerable. I mean, usually a good vibrator can make a clitoral orgasm happen almost no matter what, but that internal orgasm is not only pressure in the right places, but it's being mentally present. It's more of a vagal nerve. You know, when people have those internal orgasms, sometimes people will get strange reactions like headaches. I had a patient once with amnesia after an orgasm. People lose their sense of smell with an orgasm because of where it's located in the brain. And like Laura just said, that's that whole oxytocin release and the bonding chemicals. What more would you want to talk about with
No,
orgasm?
I think that that's just a great, like, just review. And I remember in college, like, all my girlfriends and I would be talking, we'd be like, have you ever had an orgasm? And like, if you're asking the question, then you haven't, right? Like, it's kind of like, you know it if it's there. And I sometimes think if you haven't had one in a while, you kind of forget, like, what is that and what is the sensation? So, and I think it can be frustrating, definitely for our women who are having intercourse and then can't have an orgasm. That feels very frustrating for sure. But
Which is part of the chastity culture almost, in terms of it not
yeah.
being okay to touch oneself or have a clitoral orgasm. And again, with penetration, especially if it depends on the angle and size and all the things, like the clitoris might not even get any attention. It's just the internal parts, which then often many women end up not having an orgasm and think, again, something is wrong with me.
Mhm.
We've had
Or
many
they think
patients.
something's wrong with the connection. They're like, I just
Yes,
must not think my husband is good enough or whatever. You know what I mean? Like, this must be the wrong connection because I just don't feel as connected. And it's like, well, that may not be the case because we're just not getting the right stimulation in the right place because of anatomy.
exactly. And then again, with the chastity culture, in terms of, you know, maybe oral sex hasn't been thought to be okay, or again, touching is not thought to be okay. It's then getting past that to be able to experience that and feel okay with that. You know, we think about, why do women have, or why do people have issues with orgasm? It could be just, again, lack of knowledge in terms of anatomy. It can be menopause in terms of there's no estrogen down there, there's no blood flow down there. Just a real quick aside, I had a patient last week who said, social media says I need vaginal estrogen. And I'm like, but you have systemic estrogen. So please just know, if your systemic estrogen with a patch or a pill or a gel or a spray is fine, your estrogen level, we can always check it just to prove to you that your estrogen level is good. You don't have to take vaginal estrogen. Systemic estrogen can be enough. But having said that, again, menopause can cause the clitoris to not be able to have that blood flow, the tissues in the vagina not to have the blood flow. There can be medical conditions such as multiple sclerosis can cause where the nerve endings don't work, and often they just need a lot louder of a signal, a better vibrator, more direct touch.
I'm also going to bring up another one to kind of overlap, which is excessive alcohol consumption. I think sometimes we forget just because our days are so stressful and we have like one glass of wine, which may be two, and all of a sudden, like your sexual function probably is not going to work as well, right? Alcohol is numbing and it's numbing, right? It's numbing across the board. And
Well said.
so if, it can be helpful to be like, my goal for, the next month is really to optimize my sexual health, then you may want to be like, how can I come up with a different relaxing technique that maybe is not alcohol, or frankly marijuana too, I think is quite numbing, which has been more in play for women's day-to-day
Right.
relaxation.
Which is really interesting. A good friend of ours, Becky Lynn, Dr. Lynn, she actually has done research on the use of cannabis and sexual desire, and what she's found makes sense. Similar to alcohol, a little bit of alcohol reduces inhibition and can make the sexual experience better, but too much alcohol is bad. Same thing with cannabis. Sometimes a little bit of cannabis actually can help reduce inhibition, can improve desire, set the worries aside, but too much cannabis, again, like you said, forget it.
Mm-hmm. Yeah,
You know,
great.
Celia, I just noticed we've been talking about this for almost an
I
hour,
know.
and
I
we could
know.
continue talking about this for probably more hours. I think takeaway tip: get a sex deck. We're working on the sexual health guide, the journal that will go with the sex deck. All of those things we're working on, and we'll get those out. And just another quick aside, we did a continuing medical education activity at TRU, a group from Kalamazoo, physicians and nurse practitioners and PAs came up from Kalamazoo. And I had them take a quiz about, like, do they have a tool? How is their knowledge? And then show them the sex deck and presented the poster actually at a meeting in South Africa. But it was really interesting how, again, I wish these decks were in the pocket of every healthcare provider so we could provide a better resource for all of you out there in the world and we can reach more people. But I wonder, on that note, sorry, if we should go to questions.
Yeah, let's go to, I forget if we do take-home tips first or questions for our doctors.
In the handout, it's questions first, but whatever.
Okay. Yeah, so take-home tips. Number one, you are worth it. You are worth thinking about this, spending some time to reflect on what are your barriers to optimizing your sexual health.
And again, if you haven't been sexually active in a while or haven't felt connected, once you are, it's like, okay, yeah, this is a good thing. This is an important thing.
Yeah. Right. Number two, I'm going to say it because I know it's Dr. Bittner's favorite phrase. Know your phase of ovarian function. So, starting with your first menstrual cycle, your ovaries are on and ready to function, and that changes over the course of your life. That changes the amount of estrogen and other hormones that your body has. You need to know where you are at because different medical problems may come up that correlate with those change of different hormones. And it's hard to understand a treatment plan or a diagnostic plan of how to treat symptoms, other disease processes, if you have no idea where your ovaries are doing for you.
Exactly. And like in perimenopause, your testosterone level might be fine. Your testosterone level might be really low. We can check that. In menopause, some women make testosterone years after they stop making estrogen, but some women don't. And some women don't have testosterone and they do just fine. So again, it's just having that conversation, but it starts with, what is your phase?
Yeah. All right. Number three, desire changes as you age. Embrace the change.
I think a lot of this too goes to, for example, in menopause, we don't have to worry about maybe becoming pregnant. And that was always a worry. Or the kids aren't home, although they might be coming back, right?
Yeah.
So it's just knowing that things change, body parts change, self-image changes, but it's about the connection. Again, it's about intimacy and pleasure.
None of that, but you are growing wiser every day, right? And some of this is just embracing like how amazing you may feel as a woman now, right? I definitely wouldn't want to go back to being 21 with all of my lack of confidence of all the different things, right? Because I think that it's so much more fun now to have more confidence in myself, and just because I've been able to be through different hardships in life, like that's amazing, and that can be harnessed into your sexual health.
Oh my God, I'll be 60 this summer. Lord, like that sounds terrible, but
gosh.
yet I wouldn't trade it. Like it's the best. Like I'm just getting started. So life is
okay. Number 4. There are treatment options for your low desire. So we reviewed some earlier in our talk, and I think it's everywhere from, medicines you can take, shots that you could do, to pelvic floor therapies, vibrators, right? There's just so many different things that you can do. So always worth a conversation.
Yep. And just very briefly, we didn't get to and other topics, but there was a paper published about topical Viagra cream helping with orgasm. And we have 2 patients using that right now. It's off label. It's not FDA approved, of course. It's compounded, which generally we're not fans because, again, it's very inconsistent, but this is very safe. We're not going to cause any harm. And it's really helping these women with orgasm and with arousal response. So, we're very open to new things as they come up. I've always been poo-pooed the plasma. I'm blanking.
The PRP?
Thank you, PRP. Yeah. There was one study just in the Green Journal that PRP might actually be something that's helpful. And so, again, we're open to those things. We want to make sure we're using evidence-based medicine, but more treatments are coming out all the time.
Yeah, and I just want to put an asterisk around the compounding part, because I think, particularly with the weight loss world, the word compounding pharmacy has gotten really confusing, right?
Yes.
Right. I think that compounding pharmacies are super important because what they were designed to do, right, is to take a medicine and turn it into something that was maybe needed for that patient. So maybe there was a dose that was only available for adults, but we need it for a child. Maybe that it was only available in a pill, but we need it as a cream. Like there's a lot of ways that compounding pharmacies are helpful. So they're not all, our office has been sort of not, we've never chosen to go down the pathway of offering compounding weight loss drugs, but we do utilize compounding pharmacies in ways that we think are safe. And I think this is a great example of what that is.
I love that. I mean, all the
Yeah,
respect, but we took the oath safety first. And so we just want
that's
to make
right.
sure you're safe and,
Yeah.
after that. So,
All right. Number 5, there are treatments to optimize your vaginal health related to hormone changes. So not every woman, I think one of the summaries to say is not every woman needs topical vaginal estrogen, because if you have estrogen in another format, meaning going everywhere in your body, you may not need it. However, there are times when women are told that they can't take it, which most likely is not true. Is there someone who can't take topical estrogen?
yeah. I mean, for example, if a woman has uterine cancer that's
Yeah.
further advanced than a 1A1 or 1A,
Okay.
and sorry, it's getting late. So if there's, if it's past that very early first stage, then potentially she's at risk for a local recurrence. So that estrogen, if there's one uterine cancer cell at the top of the vagina, that vaginal estrogen
Okay.
could make that grow. That's about the only person who can't take vaginal estrogen. We also in the office have the Mona Lisa Touch. It's the vaginal laser. It doesn't work for everybody. It doesn't work as well as estrogen. It's safe. It does not cause harm. And we have patients who come in for the Mona Lisa Touch, and it really does give benefit. Again, it's not as good as estrogen, but it does offer benefit. And so, again, there are treatments. Have the conversation.
Awesome. All right. So we know that there are women out there who don't live in our area that we serve and want to bring questions back to their providers or doctors that they're seeing. Question number 1, what is my phase of ovarian function, right? Understanding where your body is at. And that should be at least the beginning conversation that a doctor can help guide you through and help you figure out.
Right. Especially if you're not having periods because you've had a hysterectomy, but you still have your ovaries or you have an IUD, then there are blood levels. There are just to be listened to hear your story. Usually we can figure it out. So again, an important question to ask.
Yeah. Number 2,
Are
are you
you
comfortable? Oh, go ahead.
Are you asking your provider, are you comfortable talking about sex? I mean, you can pick up on those cues that they don't want to bring it up. We docs, we don't like talking about things that we don't know about because it makes us feel inadequate, right? So if they're obviously uncomfortable, then say, hey, refer me to somebody who is. It's okay. It's okay to say you don't know, right? So it's okay to ask that question, and there might actually be some relief in the room, right? Like, yeah, I'm not comfortable talking about it, but hey, go see my colleague. And we want to be validated and heard, right? So make sure you're heard.
Yeah. Number 3, for your doctors, do you feel comfortable prescribing all menopausal hormonal therapy? I mean, I cannot believe the stories I've heard of reasons why doctors won't write scripts for menopause hormones. They
My
think they're
aunt,
dangerous. Their wife didn't like it. Their grandma died of breast
yeah,
cancer. The list goes on and on and on.
yeah.
So you have to have someone that really understands menopausal hormonal therapy. If the answer is they won't prescribe it as a flat no, that makes absolutely no sense. It's one of those things that you should have a doctor who knows and understands the ins and outs of menopausal hormonal
Yes.
therapy.
And please, all of you know that when we say doctor, it means healthcare provider, nurse practitioner,
Yes, of course.
right? And I know you mean that, Celia, but just to be
Yeah.
clear, like again, it's about the training, and we say like, I don't want your treatment to be limited by the level of training of the person that you see. And so it's to make sure that you're getting all the options offered. And, a lot of our literature has those, all the options presented so we can go through them together.
And I think this overlaps a lot in the weight world because I hear it too all the time where people come see me and they're like, my primary care doctor just doesn't believe in weight loss drugs.
Like, what do you mean they
And
don't believe in them?
And in modern medicine, I mean, it's not up to me whether or not I believe in something, right? It's part of a treatment plan to help, guide women through onto being healthier, happy lives. And so you got to find someone who maybe is well trained, but at least is open to having that conversation of whether or not you'd be a candidate.
It's like back in the day when we started doing gallbladder surgery through a scope, right? If somebody offered you a gallbladder open with a big incision, you'd be like, are they from the archaic times, right? Like, yeah, I don't believe in doing a scope gallbladder, right? Like, it's like we as doctors, nurse practitioners, we've got to be, go with the times and embrace change and new developments. And again, make sure we're keeping people safe, but give people the options.
Yep. Number 4.
Are you open to exploring why I have low libido? And so again, are they comfortable talking about it? Do they know options? Are you open to having this conversation?
I think this runs into something that we see a lot, and I think our office does a great job with, is hormone testing, right? So there's some offices that, like, the second you walk in the door and take a breath, they're like drawing your blood for like 1,000 different things, right? Hormones included, and you didn't even say what you needed. And then there's offices that say, no, I'm not drawing any hormones at all, right? Neither of those options is what we do. We got to hear your story. We have to get an understanding of what your goals are and what symptoms you're having. And blood levels of your hormones may be part of that treatment or diagnostic plan of how we can help you. So that's a little bit of, I think, what we're getting at here is making sure that your doctor isn't all in one camp or the other.
Right. That you said it well. We hear your story and we see how things apply. And sometimes it's just really validating, right? Like, oh, that is a low estrogen symptom. That is a low testosterone symptom. Okay, I'm validated. I'm heard. I'm not broken.
Yeah, great. Number 5. Do you have resources for a pelvic floor therapist? I love pelvic floor therapists. I think they're awesome. I think everyone should see them probably.
Yes. And, it's just so important, even in breathing, right? Like,
oh my gosh,
it's amazing. Like, if you just sit here and take a deep belly breath, drop your diaphragm, open your belly, it's like your whole back just opens. You can just see like pelvic floor physical therapists, they just, and you want to see someone who, of course, is a certified pelvic floor a certified physical therapist, especially if they're also trained in functional physical therapy. But a pelvic floor PT also really understands how the core is so involved with everything, movement, breath, sleep.
Yeah. So I convinced one of my friends to go see a pelvic floor therapist, and she texted me and said, well, I guess apparently I've been breathing wrong my entire life. And I was like, I just laughed because I think that's true. Like, that we hear that a lot, that it starts with breath. It starts with our movements. As I said before, I continue to be surprised at things that improve with pelvic floor therapy. So don't be shy. If you don't like your pelvic floor therapist that you get referred to, find somebody else. Yeah, that's right. Yeah. Don't stick around with someone that you don't like and isn't helping you.
Yeah.
So that can be a great place to go.
Yeah. And if you have pain or you have fear, you don't breathe. And if you learn to breathe, sometimes it allows you to release the pain and fear.
Yeah.
So it's all connected. And Laura, thank you so much for your comments. Like people, all of us, we've got to open this conversation. And I thank you all who have been here and talking about all of this. And Laura, you are a survivor. And again, it's finding these tools, these people to pull into our village and make sure that we are taking care of ourselves and asking for what we need.
Yeah. So you can always check us out at truewomenshealth.com. We're in many different states now. If you had a friend or you're watching us from Illinois, Alabama, Tennessee, Ohio, we are in a lot of different places, mostly because we just had women that needed help in those areas. So we continue to provide, in-office support as well as telemedicine support to women in many different places. And if you need help, we even have different, on our website, we have the menopause transition scale. If you're just interested in just beginning the tip of learning about your body and your phase of ovarian function. So regardless of whether or not you want to see us as physicians or be our patients, just check out truewomenshealth.com and see what you can learn.
We love that. And also, we're now affiliated with a group called Together Women's Health. And as they spread throughout the country, we'll be affiliated with their offices. And again, if you see a provider at the Together Women's Health offices, like, they can refer you to us, they can help you find us. and get in and see us and one of our nurse practitioners or one of our docs and get you the help you need. This has
All
been fun.
right. So fun. We could talk about this for hours, couldn't we? Yeah.
That's great.
All
All
right.
right. Thanks, everyone.
Enjoy the night, guys. Bye.
Be safe.